Depression, understanding, symptoms and treatment options, mood disorders. Hey everyone, and welcome back to the channel. Today, we're tackling one of the most misunderstood, yet incredibly common mental health conditions, depression. You've probably heard people say, "I'm so depressed," after a bad day. But clinical depression is far more than just feeling sad or having a rough week. It's a serious medical condition that affects approximately 280 million people worldwide, making it one of the leading causes of disability globally. So what exactly is depression? How do you know if what you're experiencing is more than just sadness? And what can you do about it? Let's dive in. First things first, let's clear up a major misconception. Depression is not a choice. It's not something you can just snap out of or fix with positive thinking. Depression is a complex mental health disorder that involves changes in brain chemistry, neural circuits, and hormonal systems. It's as real and legitimate as diabetes or heart disease, and it deserves the same level of medical attention and respect. Everyone feels sad sometimes. That's a normal part of being human. You might feel down after a breakup, the loss of a loved one, losing your job, or just having a string of bad days. This kind of sadness is situational and usually improves with time. But depression is different. It's a persistent feeling of sadness, emptiness, or hopelessness that lasts for weeks, months, or even years. It colors everything in your life, making even simple daily tasks feel overwhelming and impossible. Clinical depression, also called Major Depressive Disorder or MDD, is diagnosed when someone experiences at least 5 specific symptoms for 2 weeks or longer. Let's talk about these symptoms in detail, because recognizing them is the first step toward getting help. The most obvious symptom is a depressed mood most of the day, nearly every day. This isn't just feeling a little blue, it's a deep, pervasive sadness or emptiness that doesn't lift. Some people describe it as feeling numb or emotionally flat, like all the color has drained from the world. Others experience it as an overwhelming sense of hopelessness, like nothing will ever get better. Another hallmark symptom is anhedonia, which is the loss of interest or pleasure in activities you once enjoyed. Things that used to make you happy, hobbies, spending time with friends, favorite foods, sex, suddenly feel meaningless or uninteresting. It's like your brain's reward system has shut down. You might find yourself going through the motions of life but not really feeling anything. Significant changes in appetite and weight are common. Some people lose their appetite completely and drop weight rapidly without trying. Food becomes tasteless and eating feels like a chore. Others experience the opposite, increased appetite and weight gain, often turning to comfort foods to try to fill the emotional void. Both extremes can indicate depression. Sleep disturbances are incredibly common. Many people with depression experience insomnia, lying awake for hours unable to shut off their racing thoughts, or waking up at 3 or 4 in the morning and being unable to fall back asleep. Others sleep excessively, sometimes 12 to 14 hours a day, using sleep as an escape from their painful emotions. Yet they still wake up feeling exhausted and unrefreshed. Psychomotor changes involve how you move and speak. Some people with depression experience psychomotor agitation. They feel restless, can't sit still, pace constantly, wring their hands, or fidget excessively. Others experience psychomotor retardation. They move and speak very slowly. Their reactions are delayed, and even simple movements feel like pushing through thick mud. These changes are noticeable to others. Fatigue or loss of energy is almost universal in depression. We're not talking about ordinary tiredness that improves with rest. This is bone-deep exhaustion that makes even getting out of bed feel like climbing Mount Everest. Simple tasks like showering, making breakfast, or answering emails become monumental challenges, requiring enormous effort. Your body feels heavy, and everything requires more energy than you have. Feelings of worthlessness or excessive guilt plague many people with depression. You might constantly criticize yourself, dwell on past mistakes, feel like a burden to others, or believe you're fundamentally flawed or bad. These thoughts are often irrational and disproportionate to reality, but they feel absolutely true when you're depressed. You might blame yourself for things that aren't your fault or feel guilty about being depressed in the first place. Difficulty concentrating, thinking clearly, or making decisions is another common symptom. Your mind feels foggy. You might read the same paragraph 5 times without absorbing the information, forget what you were saying mid-sentence, or spend hours agonizing over simple decisions. This cognitive impairment affects work performance, academic achievement, and daily functioning. The most serious symptom is recurrent thoughts of death or suicide. This might start as passive thoughts like, "I wish I would just disappear," or "everyone would be better off without me," and can progress to active suicidal ideation or planning. If you're experiencing suicidal thoughts, please reach out for help immediately. Call the National Suicide Prevention Lifeline at 988. Text HELLO to 741741 or go to your nearest emergency room. You are not alone and help is available. Now, depression isn't one size fits all. There are several types worth understanding. Major Depressive Disorder is what we've been primarily discussing. The classic form involving the symptoms we just covered. Persistent Depressive Disorder, formerly called dysthymia, is a chronic form where symptoms are present for at least 2 years, but may be less severe than MDD. It's like living under a gray cloud that never completely lifts. Seasonal Affective Disorder, or SAD, follows a seasonal pattern, typically occurring during fall and winter months when there's less natural sunlight. People with SAD often experience fatigue, weight gain, and oversleeping. Light therapy using special lamps can be particularly effective for this type. Postpartum depression affects women after childbirth, involving severe depression, anxiety, and exhaustion that interferes with caring for the baby and managing daily tasks. It's different from the baby blues, which are milder and shorter-lived. Postpartum depression requires professional treatment and is nothing to be ashamed of. Bipolar disorder involves episodes of depression alternating with periods of mania or hypomania. Elevated mood, increased energy, impulsive behavior, and decreased need for sleep. This is a distinct condition requiring different treatment than unipolar depression. Psychotic depression occurs when severe depression is accompanied by psychotic features like delusions or hallucinations, often with themes of guilt, worthlessness, or illness. This requires immediate medical attention. So what causes depression? Like most mental health conditions, it's multifactorial. Biological factors play a significant role. Brain chemistry imbalances, particularly in neurotransmitters like serotonin, norepinephrine, and dopamine, are involved in depression. However, it's more complex than just a chemical imbalance. Brain structure and function differences have been observed in people with depression using neuroimaging studies. Genetics matter substantially. If you have a parent or sibling with depression, you're 2 to 3 times more likely to develop it yourself. However, genes aren't destiny. Many people with a family history never develop depression, while others without family history do. Genes create vulnerability, but they don't guarantee you'll become depressed. Hormonal factors influence depression risk. thyroid problems, reproductive hormones, and stress hormones all affect mood. This is why hormonal transitions like puberty, pregnancy, postpartum, and menopause can trigger depressive episodes in vulnerable individuals. Psychological factors include personality traits, thinking patterns, and coping styles. People who are naturally pessimistic, have low self-esteem, or tend to ruminate excessively may be more prone to depression. Chronic stress from work, relationships, or financial problems can overwhelm coping mechanisms and trigger depression. Environmental and life factors are hugely important. Traumatic experiences, especially in childhood, abuse, neglect, loss of a parent, significantly increase depression risk. Major life stressors like divorce, job loss, serious illness, or financial hardship can trigger depressive episodes. Chronic medical conditions, chronic pain, and social isolation all elevate risk. Substance use can both contribute to and result from depression. Alcohol and drugs can trigger or worsen depressive symptoms, while some people turn to substances trying to self-medicate their depression, creating a vicious cycle. Depression doesn't just affect your mood, it impacts your entire body. People with depression have higher rates of cardiovascular disease, diabetes, obesity, and chronic pain conditions. Depression weakens the immune system, making you more susceptible to infections. It's associated with inflammation throughout the body, which contributes to various health problems. The cognitive effects are significant. Depression impairs memory, attention, executive function, and processing speed. These cognitive symptoms can persist even after mood symptoms improve, a condition called cognitive residual syndrome. This is why some people struggle to return to full functioning even after feeling better emotionally. Depression profoundly impacts relationships. When you're depressed, you might withdraw from friends and family, have less patience and emotional availability, or become irritable and difficult to be around. This can strain even the strongest relationships, creating additional stress and isolation that worsens depression. Work and school performance suffer. Concentration problems, fatigue, and motivational deficits make it hard to perform at your usual level. Many people with untreated depression lose jobs or drop out of school. The economic impact of depression is staggering, with billions lost annually in healthcare costs and lost productivity. But here's the crucial message: depression is highly treatable. Approximately 80 to 90% of people with depression eventually respond well to treatment. The key is finding the right treatment or combination of treatments for you. Psychotherapy, particularly cognitive behavioral therapy or CBT, is extremely effective for depression. CBT helps you identify and change negative thought patterns and behaviors that contribute to depression. You learn to challenge distorted thinking, develop coping skills, and engage in activities that improve mood. Interpersonal therapy focuses on improving relationship patterns and communication skills. Behavioral activation is a specific approach where you deliberately schedule and engage in activities that bring pleasure or accomplishment, even when you don't feel like it. This helps break the cycle of avoidance and withdrawal that maintains depression. Antidepressant medications are often helpful, especially for moderate to severe depression. SSRIs like Prozac, Zoloft, and Lexapro are typically tried first due to their effectiveness and relatively mild side effects. SNRIs like Effexor and Cymbalta are another option. Atypical antidepressants like Wellbutrin work differently and may help when others don't. It's important to understand that antidepressants aren't happy pills or quick fixes. They typically take 4 to 6 weeks to reach full effectiveness, and finding the right Medication often requires some trial and error. Side effects can occur, but usually improve within a few weeks. Never stop antidepressants abruptly. Work with your doctor to taper safely. For treatment-resistant depression that doesn't respond to therapy and medication, other options exist. Electroconvulsive therapy, or ECT, despite its scary reputation, is safe, effective, and performed under anesthesia. It works faster than medication and is particularly useful for severe depression with psychotic features or active suicidal ideation. Transcranial magnetic stimulation, or TMS, uses magnetic fields to stimulate specific brain regions. It's non-invasive and effective for people who haven't responded to medications. Ketamine treatment, including the FDA-approved nasal spray Spravato, shows rapid effects for treatment-resistant depression and can reduce suicidal thoughts quickly. Lifestyle interventions are powerful, though they're not substitutes for professional treatment in moderate to severe cases. Regular exercise is as effective as antidepressants for mild to moderate depression. Aim for 30 minutes of moderate activity most days. It doesn't have to be intense. Walking counts. Sleep hygiene is critical. Maintain a consistent sleep schedule. Create a relaxing bedtime routine. Avoid screens before bed, and ensure your bedroom is dark, quiet, and cool. If sleep problems persist, cognitive behavioral therapy for insomnia can help. Nutrition matters more than you might think. A Mediterranean-style diet rich in fruits, vegetables, whole grains, fish, and healthy fats supports brain health. Limit processed foods, sugar, and excessive caffeine. Omega-3 fatty acids from fish or supplements may have antidepressant effects. Social connection is protective against depression and aids recovery. Even when you want to isolate, push yourself to maintain social contact. Reach out to friends, join support groups, volunteer, or participate in community activities. Meaningful, social relationships are fundamental to mental health. Mindfulness and meditation practices reduce depression symptoms and prevent relapse. Apps like Headspace or Calm make these practices accessible. Even 5 to 10 minutes daily of mindfulness can make a difference. Structure and routine help when depression makes everything feel chaotic and overwhelming. Create a daily schedule. Break tasks into small, manageable steps. Set realistic goals and celebrate small victories. Let's bust some dangerous myths about depression. Myth: depression is just weakness or self-pity. Reality: depression is a legitimate medical condition involving brain chemistry and function. It takes tremendous strength to face depression and seek help. Myth: antidepressants change your personality or turn you into a zombie. Reality: effective antidepressants should help you feel like yourself again, not numb or different. If medication makes you feel unlike yourself, talk to your doctor about adjusting the dose or trying something else. Myth: therapy is just talking about your problems and doesn't really help. Reality: evidence-based therapies like CBT involve active skill building and have decades of research supporting their effectiveness. Therapy teaches you tools to manage depression long-term. Myth: if I start treatment, I'll have to stay on medication forever. Reality: treatment duration varies. Some people benefit from time-limited treatment, while others manage chronic depression long-term. Your treatment plan should be individualized and reassessed regularly. Myth: people with depression are just attention-seeking. Reality: most people with depression hide their symptoms due to stigma and shame. Many suffer silently for years before seeking help. If you're experiencing symptoms of depression, please reach out for help. Talk to your primary care doctor, contact a mental health professional, or call a crisis helpline if you're in immediate distress. Early treatment leads to better outcomes and prevents depression from becoming chronic. Recovery is possible, but it requires patience and persistence. Healing isn't linear. There will be good days and setbacks. Be compassionate with yourself. Depression isn't your fault, and you deserve support and treatment. For those supporting someone with depression, your role is vital. Listen without trying to fix or minimize their feelings. Avoid phrases like, "just think positive," or "others have it worse." Offer practical help with daily tasks. Encourage professional treatment without being pushy, and take care of your own mental health too. In conclusion, depression is common, real, and treatable. It's not a character flaw or something to overcome through willpower alone. With proper treatment, support, and self-care, people with depression can and do recover to live full, meaningful lives. You don't have to suffer in silence, and brighter days are possible. If this video helped you, please like and share it with someone who might need it. Subscribe for more mental health content, and share your story or questions in the comments. Remember, seeking help is a sign of strength. Thanks for watching, and take care of yourselves.